To access free topic sheets, worksheets, or to book an online class, visit ilearneasy.co.uk. Types of teeth. In this video, we will learn about the different types of teeth. On average, children have 20 teeth. Adults have 32 teeth. Teeth are a very important part of the digestive system. They initiate the mechanical breakdown of food through chewing and preparing it for further digestion in the stomach and intestines. Teeth also help us with speech. Our teeth are different shapes and sizes. The reason for this is because they have different functions, each with a specific function related to the process of chewing and breaking down food. The 4 types of teeth are incisors, canines, premolars, molars. Incisors. We have 8 incisors, 4 on the top jaw and 4 on the bottom jaw. They are at the front of the mouth. Incisors are thin and flat with sharp edges. They are used to bite into food and to cut it into smaller pieces before it's processed further by other teeth. Next to the incisors on each side are canines. We have 4 canines, 2 on the top jaw and 2 on the bottom jaw. Canines are pointed and sharper than incisors. Canines are used to tear and rip tough food, for example, meat. Next to the canines on each side are the premolars. We have 8 premolars, 4 on the top jaw and 4 on the bottom jaw. Premolars are broad and flat, with 2 or more cusps. The cusps are points used for grinding. Premolars are used for crushing and grinding food, especially harder food like nuts or fibrous vegetables. They help break down the food further into smaller particles. Next to the premolars are the molars. We have 12 in total, 6 on the top jaw and 6 on the bottom jaw. The molars are situated at the back of the mouth. These are broader than the premolars. They have large flat surfaces with several cusps. The molars are used to crush and grind food. They are critical for the final stages of digestion, where food is broken down into smaller pieces that are easier to swallow and digest. Wisdom teeth. Wisdom teeth are the 3rd set of molars. They typically emerge in late adolescence or early adulthood. For many people, these teeth may be removed if they don't fit well in the mouth or if they cause issues. Teeth have different parts. The different parts of a tooth have different functions. Each part of the tooth plays an essential role in maintaining its strength, function, and overall health. In this video, we will learn about the different parts of a tooth. The different parts of the tooth are crown, neck, root, enamel, dentin, pulp, gum, periodontal ligament, cementum, nerves and blood vessels, bone. Crown. The crown is the visible part of the tooth above the gum line. The crown is responsible for chewing and grinding food. Its hard surface is covered by enamel, which protects the tooth from wear and decay. Enamel. The enamel is the hardest substance in the human body. It covers the crown. The enamel protects the tooth from damage caused by chewing, hot and cold foods, and acidic substances. It also prevents tooth decay. Enamel is the hardest substance in the human body. Dentin. Dentin is the layer beneath the enamel. It makes up most of the tooth structure. Dentin supports the enamel and is more sensitive. It transmits signals to the tooth's nerve center. For example, heat or cold signals. Pulp. The pulp is the soft tissue inside the tooth that contains nerves, blood vessels, and connective tissue. The pulp nourishes the tooth and provides sensory functions. It also helps with the tooth's growth and development. The dentin encases the pulp, protecting it along with the outer enamel. The neck of the tooth connects the crown to the root. The neck also serves as a junction point for gums to attach and support the tooth. Root. The root is the part of the tooth that's embedded in the jawbone, anchoring it into place. The root helps hold the tooth securely in the mouth, providing stability and support. It also contains the root canal, which houses nerves and blood vessels. The nerves and blood vessels within a tooth are crucial for its function. They supply nutrients, maintain tooth health, and provide sensory feedback. This helps to protect the tooth from harm. The nerves, particularly in the pulp, allow the tooth to sense pain, pressure, and temperature changes. The blood vessels deliver oxygen and essential nutrients to the pulp and dentin, ensuring the tooth remains alive and functional. Periodontal ligament. The periodontal ligament is a network of fibers that connects the tooth's root to the surrounding bone. The ligament holds the tooth in place and helps absorb the forces generated during chewing and biting. Cementum. The cementum is a thin layer of bone-like material covering the root. The cementum helps to anchor the tooth to the jawbone by attaching the tooth to the periodontal ligament. Gum. The gum is the soft tissue surrounding the base of the teeth. The gums help to protect the roots of the teeth and support overall oral health by sealing the area where the tooth and jaw meet. The bone plays a crucial role in supporting and anchoring your teeth. Baby teeth. A child has 20 baby teeth, 10 on the top and 10 on the bottom. Baby teeth start growing at around 6 months old. They are temporary. They start falling out at around the age of 6. Baby teeth are smaller, whiter, and rounder. Baby teeth are important for proper jaw growth and guiding adult teeth into place. They help children to eat and to speak properly. Baby teeth roots are shorter and thinner. These roots shrink and dissolve when adult teeth start coming in. The enamel of baby teeth are thinner, which means they can get cavities faster. Adult teeth. An adult has 32 teeth, including wisdom teeth. They start replacing baby teeth at around 6 years old. Wisdom teeth come in later, between the ages of 17 to 25. Adult teeth are permanent and are designed to last a lifetime. Adult teeth are bigger and stronger. They're needed for chewing, speaking clearly, and keeping your face looking full and healthy. Adult teeth have longer and stronger roots that are anchored deeply into the jaw. Their roots are permanent, so if an adult tooth is lost, then it doesn't grow back. They have thicker enamel, which makes them a bit tougher against decay. Dental diseases. There are many different types of dental diseases. It's important to understand dental diseases in order to be able to identify them in their early stages to prevent irreversible tooth damage. It's vital to maintain good oral hygiene practices, such as regular brushing, flossing, visiting your dentist for checkups, and consuming a healthy diet with minimal sugary snacks and drinks. In this video, we will learn about the common dental diseases, how to identify them, and the treatment options available. Enamel hyperplasia. This is a developmental defect that affects the outer layer of the tooth, which is known as the enamel. It means that the enamel is thinner than normal or incompletely formed. Enamel hyperplasia can result in teeth that appear pitted or grooved, rough or uneven, discolored, and they're more prone to decay or sensitivity. Enamel hyperplasia usually occurs when something interferes with the proper formation of enamel during childhood. This is when the teeth are developing. Some common causes are nutritional deficiencies, especially vitamin A, C, or D, high fever or illness during early childhood, prenatal issues, for example, maternal illness or premature birth, infection, for example, measles or chickenpox, trauma to a developing tooth, genetic disorders, or exposure to toxins. The treatment for enamel hyperplasia depends on its severity. Alongside regular dental monitoring to prevent decay, some treatment options are fluoride treatment to strengthen the enamel, bonding or resin fillings, or crowns in severe cases. Granuloma. A granuloma is a small area of chronic inflammation caused by the body's immune system. This is a result when the body's immune system is trying to wall off substances it sees as foreign, but it can't eliminate. This can occur anywhere in the body. In the mouth, it can often occur at the tip of a dead or infected tooth. There are different types of granulomas, such as infectious, non-infectious, and foreign body granuloma. The treatment for granuloma depends on the cause. Some treatment options are antibiotics, root canal treatment, tooth extraction, or surgical removal. Cyst. A dental cyst is a fluid-filled sac that forms in the jawbone or soft tissues of the mouth, often around a dead or developing tooth. It's lined by epithelial tissue and usually grows slowly. Some common causes are untreated tooth infections, impacted or unerupted teeth, trauma to the tooth, developing disturbances, or genetic conditions. The treatment options for dental cysts depend on the severity. Some treatment options include surgical removal of the cyst, tooth extraction if the associated tooth is non-restorable, root canal treatment if the tooth can be saved, marsupialization for large cysts. This is a procedure to reduce the size before full removal. Alongside this, regular follow-ups are required to check for recurrences. Caries, also known as tooth decay. Dental caries is the destruction of tooth structure caused by acids produced by bacteria in dental plaque. Over time, the acids break down enamel and can progress deeper into dentin and eventually the pulp if untreated. If untreated, this can lead to irreversible complications, including the loss of the tooth. There are 3 stages of caries. Superficial caries. This is also known as initial or enamel caries. This is limited to the outer enamel layer. It appears as white spots or a slight discoloration. This is not often visible unless dried or seen on X-rays. Superficial caries usually has no pain, but it may cause mild sensitivity to sweets or cold. The treatment options are remineralization and sometimes sealants or small preventative fillings. Medium caries, also known as dentin caries. This decay extends from the enamel into the dentin. The dentin is the softer layer beneath the enamel. The decay appears as visible brown or black spots or even holes on the tooth. This can be detected on clinical exam or X-rays. Medium caries causes mild to moderate discomfort, as well as sensitivity to cold, sweet, or pressure. The treatment options include removing the decay and restoring the tooth using fillings. Deep caries. This decay reaches close or into the pulp. The pulp is where the nerve chamber of the tooth is. This decay appears as a large visible cavity, often with tooth structure loss. Deep caries causes severe pain, sensitivity, and can lead to infection or abscess if untreated. The treatment options depend if the pulp is infected. If the pulp is not yet infected, then the treatment options are indirect pulp capping or deep filling. If the pulp is infected, then the treatment options are root canal treatment or extraction. Pulpitis. Pulpitis is the inflammation of the dental pulp. This is the soft tissue inside the tooth that contains nerves and blood vessels. Reversible pulpitis refers to mid-inflammation of the pulp. The tooth can heal on its own if the cause is treated early. This can be caused by early cavities, tooth grinding, exposed dentin, or recent dental work. Reversible pulpitis can result in short, sharp pain triggered by hot, cold, or sweet. The treatment is to remove the cause of the inflammation. This includes cleaning the cavity and placing a filling. Irreversible pulpitis. Irreversible pulpitis refers to severe or lasting inflammation in which the pulp cannot recover and it starts to die. This can be caused by deep cavities reaching the pulp, cracked teeth, or untreated reversible pulpitis. Irreversible pulpitis can result in lingering or spontaneous pain, even after the hot or cold trigger is gone. This pain can progress to throbbing pain or no pain if the pulp dies. The treatment is root canal treatment to remove the infected pulp or tooth extraction if not restorable. Plaque. Plaque is soft, sticky film made up of bacteria, food particles, and saliva that constantly forms on your teeth. After eating, bacteria in your mouth feed on sugars. The bacteria produce acids as a byproduct. These acids attack your enamel, leading to caries, which is tooth decay, and gum disease if the plaque is not removed. The plaque often builds up along the gum line, between teeth, on molars, and around brackets, crowns, or fillings. Plaque untreated can lead to cavities, gingivitis, or it can harden into tartar. Plaque can easily be prevented and treated by ensuring you brush your teeth twice daily, floss between teeth, alongside going for regular checkups. Tartar. Tartar is hard dental plaque that has been left on the teeth for a long period of time. It forms when plaque isn't removed and calcifies, making it very difficult to remove with regular brushing. This often builds up along the gum line, on the inside surfaces of the lower front teeth, around fillings, crowns, or braces, and on molars. If untreated, tartar provides a rough surface where plaque and bacteria can continue to grow. It can lead to gum disease, cause tooth discoloration, and results in bad breath due to the bacteria trapped in tartar. Tartar can easily be prevented and treated by ensuring you brush your teeth twice daily, floss between teeth, alongside going for regular checkups. If tartar has formed on your teeth, then professional cleaning is the only way to remove it. Gingivitis. Gingivitis is the inflammation of the gums, often caused by bacterial infections from plaque buildup. It's the mildest and earliest stage of gum disease, and it's usually reversible with proper oral care. Gingivitis is caused by plaque buildup on the teeth due to poor oral hygiene. It can lead to red, swollen, and tender gums. It can cause bleeding, bad breath, and for the gums to recede slightly. If left untreated, gingivitis can progress to periodontitis, which is more serious and harder to treat. Unlike periodontitis, gingivitis doesn't involve bone or tissue loss, so it's fully reversible if treated early. Treatment options include professional dental cleaning to remove plaque and tartar, consistent brushing and flossing at home, and antibacterial mouthwashes if required. Gingivitis can easily be prevented with good oral hygiene and regular dental checkups. Periodontitis. Periodontitis is a serious gum infection that damages the soft tissue and can destroy the bone that supports your teeth if left untreated. Periodontitis is a progression from gingivitis, the mildest form of gum disease. It's usually a result of poor oral hygiene, allowing plaque to build and harden into tartar. Periodontitis results in swollen, red, or bleeding gums, bad breath, receding gums, and even loose teeth or tooth loss. The treatment options for periodontitis are either non-surgical or surgical. Non-surgical treatments include scaling and root planing. Surgical treatments include flap surgery, bone grafts, or tissue regeneration in advanced cases. Periodontitis can be prevented with good oral hygiene, not smoking, and managing health conditions like diabetes. Stages of tooth decay. Tooth decay happens in stages. It's important to understand the different stages as it can help in getting early treatment and preserving natural teeth. There are 5 main stages of tooth decay. These include enamel demineralization, enamel decay, dentin decay, pulp decay, and abscess formation. The initial stage. Enamel demineralization is the very beginning of tooth decay. The acid-producing bacteria in your mouth weaken the tooth's enamel layer. The acids from plaque bacteria start removing minerals like calcium and phosphate from the enamel. Sometimes you may see white spots on the teeth. This is a sign of the minerals being lost. Enamel decay can follow after prolonged demineralization. The enamel becomes softened and structurally damaged, which forms the beginning of a cavity. This is a hole. Once enough enamel is lost, It can't repair itself and would require a filling. The early stage. This is also known as dentin decay. As the bacteria continues to grow on your tooth, they dig deeper, reaching the dentin. This is the layer beneath the enamel. Dentin is softer than the enamel, therefore decay can spread faster there. During this stage, you might feel slight sensitivity or pain, especially when eating sweets or drinking something cold or hot. Moderate stage. This is also known as pulp decay. This is where things start to get serious, especially if the decay isn't stopped. In the case where decay isn't stopped, it can reach the pulp. The pulp is the innermost part of the tooth that contains nerves and blood vessels. This can cause some severe pain and discomfort, like a toothache. Advanced stage, also known as abscess formation. If the decay keeps spreading, it can lead to the formation of an abscess. An abscess is a pus-filled pocket at the root of your tooth. This can cause intense pain, swelling, and infections that may spread. If the decay is not treated in time, then it can destroy your tooth beyond repair. The tooth may be extracted or it will fall out on its own. To prevent tooth decay from advancing through different stages, it's vital to maintain good daily oral hygiene practices, such as brushing, flossing, visiting your dentist for checkups, and consuming a healthy diet with minimal sugary snacks and drinks. Dental crown. A dental crown is a type of dental restoration that completely caps or encircles a damaged or weakened tooth. It looks and functions like a natural tooth. A dental crown is a custom-made cap placed over a tooth to restore its shape, size, strength, and appearance. So you can think of it as a literal crown that sits on top of a tooth that's weak or damaged. A dental crown is often made from materials like porcelain or ceramic. This is to match the natural tooth color. Metal alloys like gold or silver, porcelain fused to metal, or resin or zirconia. Crowns are used in several scenarios. They can be used to restore a weakened tooth. This can be from decay, cracks, or large fillings. To restore a broken tooth or one that's been worn down. To cover and support a tooth with large fillings. To hold a dental bridge in place. To cover misshapen or severely discolored teeth. To cover a dental implant. Or they can be used after a root canal treatment in order to strengthen the treated tooth. The procedure for a dental crown is simple. First, an initial examination is carried out alongside x-rays. The dentist evaluates the tooth and takes x-rays to check roots and surrounding bone. Next, the tooth is prepared. The tooth is filed down to make shape for the crown. If there's significant damage, the dentist may build it up with filling material. An impression is taken of the shaped tooth and the surrounding teeth. Then, a temporary crown is placed to protect the tooth. Following this, once the permanent crown has been made, which usually takes 1 to 2 weeks, the temporary crown is removed and the permanent crown is checked for fit and color. Then, it's cemented in place. A dental crown can last more than 15 years with good care. Regular brushing, flossing, and dental checkups are vital to ensure its longevity. Dental implant. Here is a healthy tooth. Here is a dental implant. A dental implant is a permanent tooth replacement that mimics both the root and crown of a natural tooth. It consists of a metal post, which is usually made of titanium, that's surgically placed into your jawbone, and a crown that sits on top. Think of it like a screw with a custom-made cap on top. The screw mimics the root and the cap mimics the tooth. Dental implants are used for a few different reasons. They can be used to replace a missing tooth, support a bridge for multiple missing teeth, anchor a full denture for better stability, preserve jawbone health by stimulating the bone like a natural tooth root would, and they can be used to improve chewing, speech, and appearance. A dental implant has three main parts: fixture, abutment, and crown. Each plays a key role in replacing a missing tooth. Implant fixture. This is also known as a screw or post. This is a titanium or zirconia screw that's surgically placed into the jawbone. It acts like a tooth root, anchoring the entire implant securely in the bone. Abutment. This is a connector placed on top of the implant fixture. It's often made from titanium, gold, or zirconia. It joins the implant post to the crown, serving as the foundation for the visible tooth. Crown, also known as the prosthetic tooth. It restores the function and appearance of the missing tooth. This is the visible part that looks like a natural tooth. It's made of porcelain, ceramic, or porcelain fused to metal. It restores the function and appearance of the missing tooth. The procedure for an implant is simple. First, X-rays or 3D scans are taken. The dentist checks bone density and oral health to make sure that you're a good candidate. Next, the implant placement surgery takes place. This is when a titanium implant post is surgically inserted into the jawbone. The area is stitched up and left to heal for a few months. During this time, the bone fuses with the implant. Then the healing period takes place. During this time, the implant becomes anchored in the bone like a natural root. Once healed, a small connector piece, known as the abutment, is attached to the implant. This part sticks out slightly from the gum and will hold the crown. Last, a custom crown is made to match your natural teeth. This is the visible part of the replacement tooth. It's either screwed or cemented onto the abutment. A dental implant can last more than 15 years or even a lifetime with good care. Regular brushing, flossing, and dental checkups are vital to ensure its longevity. Dental bridge. A dental bridge is a false tooth or teeth that bridges the gap between two healthy teeth when you're missing one or more teeth. It's called a bridge because it connects the teeth on either side of the missing space. The teeth next to the gap, called abutment teeth, are used to anchor the bridge. A dental bridge helps to replace missing teeth without surgery, restores your smile, makes chewing and speaking easier, prevents other teeth from shifting out of place, and helps to maintain your face shape. This is because missing teeth can cause sunken cheeks. There are a few steps to the procedure of fitting a dental bridge. First is the consultation and planning. The dentist examines your mouth and takes X-rays. They decide if the nearby teeth are strong enough to support a bridge. Next is the tooth preparation. The two teeth next to the gap are shaped by removing a small amount of enamel. This creates room for crowns that will hold the bridge in place. Then impressions are taken. Impressions are molds of your teeth. These molds are sent to a lab where your custom bridge is made. After that, a temporary bridge is placed to protect your gums and teeth while the real one is being made. This usually takes 1 to 2 weeks. The final step consists of fitting a permanent bridge placement. When the bridge is ready, the dentist cements the crowns onto the abutment teeth. The false tooth, called a pontic, fills the gap perfectly. A dental bridge can last 10 to 15 years or even longer with good care. It's vital that you brush and floss carefully around the bridge, especially under the false tooth. There are special floss threaders that can help to clean under the bridge. Why are your teeth yellow? Yellow teeth can happen for many different reasons, and not all of them are from poor hygiene. The most common causes are poor oral hygiene, diet, smoking or tobacco use, genetics, aging, medication, fluorosis, and tooth trauma or damage. Poor oral hygiene. Not brushing and flossing regularly can lead to plaque buildup, which makes teeth look yellow. Over time, this can harden into tartar, which is harder to remove and darker in color. Diet. Foods and drinks with strong colors or acidity can stain enamel. This includes things like coffee, tea, red wine, berries, curry, tomato sauce, sugary or acidic drinks. Smoking or tobacco use. Nicotine and tar in cigarettes and chewing tobacco leave deep yellow or brown stains that penetrate the enamel. Aging. As we get older, enamel wears down and the natural yellow color of dentin starts to show through more. Genetics. Some people naturally have thinner enamel or more yellow-toned dentin due to genetics. Medication. Certain antibiotics can cause deep staining, especially in children. Some antihistamines and blood pressure medications can also affect tooth color. Too much fluoride. Overexposure to fluoride during early childhood can cause white spots or yellow-brown staining on teeth. Tooth trauma or damage. Injury to a tooth can damage the pulp, which can cause internal discoloration. This is often yellow, grey, or even black. There are both at-home and professional ways to whiten teeth, depending on the cause and how deep the discoloration is. This can include improving oral hygiene, visiting the dental hygienist for regular cleaning. Alongside this, professional teeth whitening can be used or an at-home teeth whitening kit. It's important to also avoid food that can stain your teeth and habits that can affect your teeth, such as smoking. Teeth can be straightened by gently applying pressure until the teeth are in a straightened position. Both fixed braces and clear aligners can do this. When braces or clear aligners apply pressure to the teeth don't just slide through the gums. They usually move through the bone. This means your body needs to remodel the bone around the teeth. Braces. Fixed braces are made up of a few different parts. This includes the brackets, the arch wire, and ligatures. The brackets are the small metal or ceramic pieces glued to each tooth. It acts like a handle to hold and guide the movement of the tooth. The arch wire is a metal wire that attaches to the brackets. The ligatures are tiny elastic bands, or sometimes a thin wire, that holds the arch wire to the brackets. These are usually colorful. These different parts work together by holding the teeth in place, as they're fixed to your teeth. So, as the teeth are moving to their new straightened positions, the braces pull them along with it. The tension from the wire applies steady pressure, and your teeth slowly shift. Every few weeks, the orthodontist tightens or adjusts the wire to continue guiding the teeth until they're in their new straightened position. Fixed braces are visible, but they're very powerful and ideal for complex cases. Clear aligners. Clear aligners are thin removable plastic trays that gently move your teeth into the right position over time. They're an invisible alternative to braces. No wires, no brackets, and no metal. They fit snug around the teeth. Each set of aligners are custom made to gradually shift your teeth until they're in a straightened position. The process involves taking a 3D scan of the teeth in your mouth. Next, a set of trays is created, each one slightly different from the last. Each tray should be worn for 1 to 2 weeks, and it gently pushes your teeth closer to the final straightened position. Each set of trays must be worn for 20 to 22 hours a day for best results. Clear aligners are removable, invisible, and they're best for mild to moderate alignment.